present just his initial symptoms, when they were and what he had, and then you guys ask him any questions about the exam, about his history before this, as though he was your patient when this first happened. So, can you tell us when you first had any symptoms and what they were?
Okay, so going back to October of 1984. In October of 1984, I was a perfectly healthy, not a problem. I was on active duty in the Coast Guard, stationed in Michigan, and one morning, quite literally one morning in October of '84, I woke up and had I had a limp, like a sprained ankle kind of limp, for no reason. I mean, I woke up with it, and thought that was a little odd, and kind of let it go for a couple of days. Because I'm, keep in mind, I'm 28. I've never had any problems, so there's no reason to be alarmed that I have this limp. So I limped for a couple of days, and then I began to notice that on my right foot, I couldn't voluntarily curl my toes. Like, I couldn't just look at my toes and curl them. So that seemed a little more alarming, and started to my foot just didn't seem like it was acting right. So I went to the ship's corpsman, and who was like the ship's nurse, and showed him what was going on, and he immediately said, "This is way beyond my scope of education, and you need to see a doctor." At which point, probably a week or 10 days had already gone by, and I ended up at the doctor's office, and he was just a general practitioner. And
so let's just hold it there for a minute. So he goes to a general practitioner. He's got a limp and trouble curling his toes, and your right foot
is just not responding.
So what questions do you have for him? Go for it.
Yes.
Did you have any loss of sensation?
Initially, and you have to bear with me, this was 28 years ago, but that I remember probably a little bit, like in the, again, in the tips of my toes, but very, very vague. I mean, yeah.
So your biggest concern was what?
Just the loss of voluntary movement, and the limp, unexplained limp.
You can also ask, you can sort of do a virtual clinical exam and ask if these things were done and what the results would be. So what kinds of things would you look for besides history? What else do you want to know?
Did they take your reflexes?
Yes. Mm-hmm.
Were they normal?
What did you ask? What was that question?
Yes. Reflexes.
Did they check my reflexes? Yes. And
I know what you're going to.
okay.
What reflexes are you talking about? You want to know Babinski. You wanted to know
Like deep tendon reflexes?
deep tendon. So with the hammer, the deep tendon stuff.
Yes.
How'd that result?
I think at that time the deep tendons were probably still responding pretty well.
And
Yes.
what was your question?
Babinski, sorry.
Yes. Yes. Babinski, yeah.
So what happened with that?
It was positive. Positive, yes. It was positive. So it didn't do what it was. My foot should have, I can never remember. My foot should have curled when they did this. It should have went like that. And instead it just did that. Okay.
That.
Okay. I mean, for me it's still, even now it's still just layman's terms.
So this Babinski, what's that telling you just there?
Upper motor neuron.
Oh gosh, you guys are good. All right, but now what else do you want to know besides, so you've got an indication that there's upper motor neuron. You know that, it sounds like, did they do any sensory testing? Did they do any,
Myotome. Like the dermatome and myotome testing.
they test which areas of the skin you can feel in?
Mhm. Yeah, you know, close your eyes.
Could you feel all of them?
Probably no, not, and the bottom of my foot I would say was probably starting to get kind of dull or numb. You know, close your eyes, pick you with the pin, and then brush you with the little paintbrush.
Do they check your vision?
Yes. Vision was fine.
Why are you asking about vision?
A tumor?
Okay.
Something like impinging?
Okay, so that's a really good question. So maybe something impinging, we'll talk more about vision later, but you want to clear that. What else do you want to
Hmm?
say aloud?
Cranial nerves,
Okay, why do you want to look at cranial nerves?
just to, again, rule out any, like, compression of brainstem or anything
Okay,
like that.
so what, you can ask them, see if they did any other things you can think of quickly. What's the biggest one they do on every emergency room?
Pupils.
Pupillary.
Did they look at your pupils?
Yes. And they were fine.
Pupils were fine.
Yeah, you know, it's safe to say he gave me a complete general physical. Yeah, check, you know, just like looked in my ears and my eye, checked my eyes, and yeah, that was all done.
So vision's fine, seems like cranial nerves are fine.
Did you ever check, did they ever check your like sense of smell, like closing one nostril and smelling? No?
I can't really recall, to be honest.
But like your sense of smell was fine, I guess, yeah.
Okay. Yes, it was. Yes. No, it was.
that's asking.
I'm sorry.
That's a good question.
That was a
though.
question, yes.
Did they try to test your other side to see if you had any problems with any pain or,
Yes.
and how did that come
Yeah,
out?
the left side was fine, 100%.
Okay.
Yes?
Did you have any other like red flag symptoms like change in bowel or bladder or any like
Not at that,
chest pain,
no,
anything
no,
else?
no,
Like night pain?
no, but hold that thought.
That's a good question, all right.
Did they check your sharp and dull
Yes.
sensation?
Yes.
And were those
And
normal?
again, you know, the right foot was not nearly 100%.
Was it painful at all?
No
Was there
pain.
any pain?
No pain, no. Yeah.
Had anything like this ever happened to like in like any past medical history or family medical history?
No. No.
Any family history of diabetes?
Yeah, my grandfather.
Would they
Yeah.
maybe do like a complete like blood panel just to check for maybe like infections or any kind of things like that?
No blood work, no. No, that's a good question. They didn't do it. They did no blood work, which now is like blood work is, you know, automatic.
All right, so far, we basically, for your systems review, what have you cleared so far? You've really only, I don't know, cleared too much.
I was gonna ask integument.
Okay, that's a good one.
Like, were there any like swelling or colors or, well,
No.
not like multiple colors, but like.
No swelling, no change in color, no redness,
Yeah.
no black and blue, nothing like that.
Did they do any imaging?
No, not at that point.
We'll talk about that. This was 1984.
Yeah.
How many of you were born?
No one. This is like, this is like
We did have television back then.
13 channels, rotary dial phones. Look it up.
We had encyclopedias.
Yeah. Yeah.
What's that?
So at this point, all right, your systems review, integumentary is okay. You said vision was okay. What else in your systems review?
Strength,
Blood pressure, vitals.
Vitals. So what are you really looking at with vitals? Just what systems?
Heart
Yeah. Any issues with that?
No.
So blood pressure was okay?
Yes.
Heart rate's okay? All right. Any other systems?
you get lots of headaches?
No, no headaches. I didn't have, I wasn't the kind of person that ever had headaches.
What
Yeah.
about balance disturbances?
Not yet.
Did they ask you about what you had been doing the day before you woke up with the limp?
Probably. But that's the thing with the limp. I already knew, I'm clear on. That nothing caused the limp. I couldn't say that I hadn't fallen, I hadn't even tripped. There's nothing I could accredit the limp to.
Okay.
Yeah, just nothing. Yeah,
Were you sick recently, before you went into?
never sick.
Like no flu or anything?
No.
Like a week before. Okay.
Mm-mm.
So what are you guys thinking at this point? Like what? Just any, you don't have to give me a diagnosis, but what are you sort of ruling in or ruling out, or? Yeah, he didn't break something.
Right.
He didn't fall and break something. What about all that systems review? What does that kind of help you to do?
Are you thinking it's like more neurological, but not necessarily, I mean, you ruled out kind of the cranial nerve, so you're not thinking it's in the brain, you're thinking more towards the spinal cord.
Why are you thinking that?
Because it's not compressing on, like,
Does everything with the brain affect the cranial nerves? So everybody with a stroke, are their cranial nerves okay? Depends. I mean, if it's an anterior stroke, they'd be okay. But but the brainstem, you're saying?
yeah, brainstem's pretty much been ruled out.
Okay. Because we could have,
Yeah,
he?
true, it's you're thinking upper motor neuron, so it could still be some sort of, yeah.
Right. So we have decreased voluntary movement of the toes. We found out that he had a positive Babinski. What did that tell you?
Upper motor neuron.
And what else would you, and you could ask him, what else would he might have had? with that?
Clonus.
Did you have any clonus?
No,
No clonus.
Did you have any spasticity in your muscles?
no.
They do a Hoffman's with your middle finger, like foot.
Oh, yeah.
Was that positive?
With my fingers, that was all fine. At this point, it was, at the point that the first doctor that I saw, at that point, it was just the right foot.
Typically, sorry, this is completely wrong. If you have a positive Babinski, would you have positive clonus and Hoffman's, or are they kind of?
I have strong opinions about Hoffman's. It's the psychometrics and the sensitivity and specificity of Hoffman's are horrible. So in my opinion, it tells you next to nothing, Hoffman's. Now, the clonus question, on the other hand, you don't always have, obviously you don't. He had a positive Babinski and he didn't have clonus. So what might that tell you? Just
It's acute.
maybe acute. But it might also somehow give it an indication of the severity of the injury. I mean, it might be acute in that it's going to progress, or it might be acute in the sense that it's just not going to be very bad. So you could have an upper motor neuron lesion that does not, it could be a very, very small upper motor neuron lesion.
And some people, I thought somebody said at some point that you can test positive for upper motor neuron but not have an upper motor neuron lesion.
Of course you can, yeah. And that's why you look at all of the symptoms. So of course there's always false positives, especially with the Babinski, because remember the Babinski is actually, what is it? It's what? It's a primitive reflex. And so we're just we all have a Babinski, just like we all have an ATNR, we all have all these other things, we just inhibit them all the time. And because there's some connection between the brain and that foot that's not working, he can't inhibit it anymore. So, babies, they still have it because they're not inhibiting it yet. So, yeah, but it is pretty indicative, but there are certainly false positives. So you could. So at this point, I put some list. Cerebrum, what do you guys think? And don't think about Mark today, think about Mark in 1984. Why are you saying no to cerebrum?
Vision was good.
So vision has to be affected if it's in the cerebrum?
No.
Tiny, tiny, tiny little part. But could it be?
Yeah. You get like one artery.
Yeah, you could get one little branch. Where would it be? It would be off of the ACA, right? It would be somewhere medial. All right, so it could be, you know, one little tiny spot. I had a patient who literally just had Broca's area. That was it. So, but it's possible. So we can't rule that out yet, can we? What about basal ganglia?
You can rule out.
Why?
Because that's not, basal ganglia is more like control of movement, you know, like maybe like starting, stopping, not voluntary movement.
Did you ask him that?
He just said voluntary movement.
Well, he said, well, right, he
Oh,
lost
yeah.
voluntary movement, but what would you want to ask him? To kind of rule out the basal ganglia further.
Did you ever have tremors at rest?
No.
No tremors. What else?
In
Flailing movements.
Stopping?
Like when
Like-
you're walking, do you have trouble like stopping walking, just like?
No. No, this is all, you know, keep in mind that right now we're just, I mean, these are good questions, but it's still early.
Did you notice that when you were at least walking, could you curl your toes, like not thinking about it when you're just walking, like
I-
involuntarily?
Well, cause when I'm walking, I had a shoe on, so I didn't really notice the toe thing until, I mean, the limp was the obvious, that was the limp, at that point, the only thing affecting the walk was the limp. The toes were still functional as far as, they weren't curling, but they still were, there was still muscle I mean, they were still supporting me.
Did you notice them moving without you controlling it? Without you
No,
telling?
no.
So that's a pretty key one. You know, and the starting and stopping, but also it wasn't like his foot was shaking all the time. He wasn't having involuntary movement. So that would be a good way to rule out basal ganglia. The lack of voluntary movement was a good one too, but I would go further because you know more than that about the basal ganglia. What else tells you that it's probably not basal ganglia?
No flailing movements.
Well, a lot, not all of them, but a lot of them do have cognitive issues. Yeah, you were thinking fine, right?
Yeah,
Still are.
well,
That's a different problem.
yeah. At that point, I mean, that's a whole psych class there.
But
What I was thinking like then and what I'm thinking like now is, that's a whole psych, that's a psych class.
But what else about the basal ganglia? Well, what else in his symptoms is not consistent with a basal ganglia lesion? He did have another symptom besides the curling the toes.
The flexion
The flexion what?
dystonia.
Well, he doesn't have that,
Okay.
right?
Like the sensation.
Sensation, right. Is there sensory stuff going through the basal ganglia?
No.
No, so that wouldn't make sense. Cerebellum? What might you expect with that?
Movement tremors.
Right. You weren't slurring?
No speech issue.
Okay. And what about spinal cord? You're going for spinal cord. Why are you going for spinal cord? Based on what he said, lateral corticospinal tract, but that wouldn't explain everything, right?
Could be spinal nerve, because of sensation and motor zone.
Why isn't it spinal nerve?
Well, because I mean, it'd be flaccid, but
It'd be flaccid, but actually why, spinal nerve was a very, very good question. Why is that a much better question, a much better, in some ways, better guess than actually lateral corticospinal tract?
It was just
Because it has a mix.
It was just his toes. It was just one level, really, right? So typically with a spinal cord injury, you're gonna have, you know, everything below the level of the lesion, but he just had his toes. So spinal nerve would make a lot of sense, except for that darn Babinski.
And
But
the
maybe
sacred
it's a
mechanism.
false positive. What's that?
wouldn't it also take a mechanism of injury for, because
Typically.
it would have to be the lateral part of the lateral corticospinal tract, right?
Yes.
So,
Mm-hmm. Yeah. Was it DCML or intralateral tracts? Why? They poked him with a pin,
And it
but how do you know it's not DCML?
was pain.
Did you feel anything?
With the pin?
with any of the touch?
At that point, probably vague.
Okay,
It
so.
was vague.
It was vague, so maybe there was some DCML and not anterolateral. All right, so you guys did pretty well. So this is just review, you guys got it all. So at this point, you're thinking that, again, we've got the anterolateral tract, maybe DCML, probably not. We don't know whether they tested deep pressure or looked at a caliper to see if you could discriminate touch in your toe. I would doubt he'd do all that.
No.
So at this
I'm
point.
still at a family doctor.
All right. Cerebral cortex, we can't rule that one out, right? All right. And so now let's talk about after the family doctor and what happened. Did you go to anybody after that?
Yeah, he basically said, you need to see a neurologist. He said, you need to see a neurologist. So I went to a neurologist, and of course that's another week, 10 days goes by. So by the time I get to the neurologist, now I'm starting to have problems with my ankle. My right foot is kind of like totally involved. And now I'm starting to lose voluntary movement in my ankle, and it's sort of like moving up my calf by the time I get to the neurologist. And the limp is, if anything, is worse. So my entire right, basically from below the knee's not involved, but from the knee down, this right leg is really not right. So I get to the neurologist, and he wasn't all that interested, but anyway, so the neurologist orders.
Oh, wait, what would you do if you were the neurologist at this point? What are you thinking? What does that change? So now you just kind of had a
I'm getting worse.
Getting worse, it's progressing proximally.
Nerve conduction test.
So you might do a nerve conduction test? Yeah. I don't know if they were back there. I know they had EMGs, so they must have had them.
I think yes.
They definitely had.
I know we've never talked about that, but yeah, they did do that.
They did do
put
that.
the wires on. They put the wires on me.
Uh-huh.
Yeah, but you know, I mean, it's hard. You guys, it's really hard for you to imagine how far things have come in 28 years. I mean, by today's standards, what they were doing to me was kind of primitive, really. I mean, it was like, so they put some wires on me, like, oh, they did a conduction test. Oh, okay. You know, and then,
What else would you do?
Doesn't Guillain-Barré start?
Did you do like a MRI to look for like possible bleeding or?
oh, again, you gotta remember this. This was in a time long ago before MRIs. I mean, I can tell you now. I mean, today, if this was today, the family doctor would have gotten me an MRI. I mean, you know, that MRIs now are just like MRI. You know, just give them an MRI. No, it didn't even exist. Okay, so we're in the Stone Age.
Why are you thinking nerve conduction? And then we'll get to your question. What are you thinking?
I have no idea. You just said it.
It sounded really good.
I was just thinking, like, if
When
you,
would nerve conduction be decreased? You don't think nerve conduction's faster, right?
No.
It's not like he had superpowers in the axons.
Demyelination.
Maybe demyelination, which.
MS.
Why are you thinking Guillain-Barré?
Peripheral.
It started distal and worked proximal, so you're thinking maybe it's some type of degenerative thing.
That's actually good.
Yeah.
Guillain-Barré.
Yeah.
Yeah.
What do you think? What isn't right about Guillain-Barré?
Peripheral nervous system.
But we didn't rule out, we don't have an MRI.
Doesn't it go bilaterally? Wouldn't it?
It's typically bilaterally. What else is not consistent with Guillain-Barré?
You need sickness or infection.
Yeah, not for everybody, but for the majority, that they had some type of flu. He said he was perfectly fine. And then he doesn't have, what kind? He has upper motor neuron, not lower. So Guillain-Barré is actually definitely something that you should be ruling out. And the nerve conduction was a great way to do that. Because what would happen with Guillain-Barré with nerve conduction? It'd be decreased because it's demyelinating. Okay.
So, so what other test might you order? Before, there's no MRI,
X-ray. I'm not gonna do any good.
beyond X-ray.
CT.
Yeah. CAT scan,
Those were around back.
CAT scan, and.
They were around.
Just kidding.
Yeah, we had CAT scans and.
What would you do today so that we can tell you whether it was around or not with that CAT scan? What?
Brain, spinal cord.
Okay, where that would be where you would look at the brain and the spinal cord.
Yeah.
Angiogram. Why are you wanting to do an angiogram?
See if it's clot.
Yeah, that would be interesting, especially, yeah, that would be interesting, but, no, we're not doing that. What else can we do to image the nervous system?
Arthrogram?
What?
There you
Myelogram.
go, myelogram.
What are you gonna do with a myelogram?
Don't you put in like fluid and see the integrity of the blood-brain barrier, or is that wrong?
You're kinda heading in the right direction. What is a myelogram? Look at the myelo, which is what? Oh, spinal cord. I thought you were using your Latin there.
Oh, you could do a spinal tap.
You could do a spinal tap.
Yeah.
All right.
Yeah.
So what would maybe you look for in a spinal tap?
CSF.
A CSF, see if it has blood in it.
All right. Did they do a spinal
They
tap?
did a spinal tap, then they did a myelogram. They did a CAT scan, a spinal tap, and a myelogram. I don't know in what order, but those were the three things that the neurologist ordered. And the myelogram was brutal. I mean, because they put the dye in to my spine, and then they lay you on an X-ray table, and then they tilt the table and down, so my head's down, and when they did that, it puts this incredible pressure on your brain. I mean, like incredible. And I was admitted for overnight to have the myelogram, and I mean, it was pain to the point that I actually was pleading for them to stop. I mean, I was like, it was beyond ow. It was like, it was the worst thing I've ever had done to me. Then the after effects of the myelogram, where they brought me back to the, to the hospital, put me in a hospital bed, and for that evening, I had visitors, and I was, well, I guess like delusional. I mean, because my brain was just, it was intense. It was like my head was going to explode. It was like, imagine the worst hangover you've ever had times 10. My head was just like it was going to explode. I mean, you came to visit me, or Andrea came to visit me, and I've known her for 10 years, and I looked at her and I was like, I couldn't remember her name that evening, and it was, yeah, and I swore whatever else they did to me, they weren't going to give me another myelogram. That's how, which they did, but that's a few weeks. Anyway, we don't want to go there yet.
So what do you think? Why is he? What's going on with him? CSF what?
Like increased cranial pressure. Sounds like that kind of is.
How did it increase pressure?
The ventricles? Pushing on the ventricles.
What?
Pushing on the ventricles.
Okay.
Restricting.
All right. Well, what do you need to ask him about this headache that might help you to figure out if it's an increase in pressure or a decrease in pressure?
That I did for that night, I had to stay out like at a 45-degree angle in that I couldn't lay flat. I mean, they They put me they set the hospital bed at, I think it was like 45 degrees, and I had to stay that way.
They don't do that anymore.
And by morning, it had subsided, and after about 24 hours, it was gone, but the first 6 hours were just like what I just told you.
Okay.
Was your headache, was it like localized anywhere? Like, could you like point to it, or was it?
My entire head. That's localized, like my entire head. Yes, it's vivid. I mean, even now, it's 28 years later, it's just, incredible.
How was your vision?
Well, during that time, actually, even as bad as I was, my vision was okay, even with the headache.
What happened after
So-
you were allowed to move with your head? And was it fine?
Yeah, but within 24 hours, I was back to normal. But now, so now more time's passed, because he's got to order the myelogram, so another week goes by. So we've gone from October, the beginning of October, now we're well into November. And I had the CAT scan, and the CAT scan was poor quality. The imagery was poor, but they did see in the thoracic region of my spinal cord, they did see picture the two sides, and they did see
Myelogram?
a slight inflammation of the spinal cord in the T5-6 region, like it came down and there was a little bulge, and then it continued on. Okay, so and by now it's moved up into my knee. Now my knee's involved, and now I'm really having a hard time. I'm walking, but I'm stumbling, and it's things are getting bad, and the clock's ticking, and no.
How much time has passed?
By now, like 6-7 weeks.
So is that consistent with Guillain-Barré?
No.
What happens with Guillain-Barré?
Goes away.
It's much faster and then at this point, actually, we'd either be in the plateau or recovery phase of it. This is actually, I could not find a myelogram pre-MRI. So it doesn't look what he had didn't look anything like this, but, because I couldn't find, I was trying really hard, but, to find a myelogram pre-MRI. But essentially, we're injecting dye to see whether or not there's inflammation or blockage or some type of stenosis that's limiting the spinal cord. And what they give you as far as your diagnosis at that point.
At that point, so he gets the results, and I have to go back to the neurologist, and they started talking transverse myelitis because of the bulge in my spinal cord. So that was the first time I'd heard transverse myelitis.
Has anybody seen anybody or heard of oh, go ahead. You've seen it or heard it?
I saw it in clinic a couple weeks ago.
And what did the person present like?
Her symptoms were loss of bowel and bladder, and then she started having problems with voluntary control of her lower extremity. And when I saw her, she was getting better and was starting to get some voluntary control back in her. I guess it was her right.
So what does transverse? No, you know all these neuroanatomical terms now. What does transverse myelitis mean?
Itis is swelling
Swelling. Where?
of the myelin.
Of the myelo, which is not myelin. It's
Oh yeah, spinal cord.
spinal cord. Transverse means
Last.
at a horizontal level. So it's a really great diagnosis, right?
No.
We have they do this great image, they see inflammation of the spinal cord, and they say he has,
Inflammation of the spinal cord.
you have inflammation of the spinal cord.
Yeah.
Okay, and so I'm really, in a way, glad that your patient had a very different presentation. There are some kind of common characteristics of transverse myelitis, but you can see all kinds of things depending on what level it is and the severity of it and what's causing it. So here's just some statistics. It's inflammation of the spinal cord. It's actually relatively rare. It could be idiopathic where we have no idea. Could be associated with some type of disorder. So here's the laundry list of symptoms. So let's go through them with Mark. So it usually worsens maximally within days. Would that be consistent with Mark?
No.
No. So because we're already at 6 weeks or
6
something.
weeks, 7 weeks.
One-time occurrence, well, we don't know that yet, do we? We don't know. Leg weakness, yeah, we got that. Arms,
No.
nothing with the arms. Sensation is diminished, yep, we got that. Tingling and numbness, you did have some numbness, right?
Yes.
Yep.
Mhm.
Pain and temperature diminished, yes. Vibration and proprioception, maybe decreased or spared, and we really don't know that, because did you feel where your foot was in space?
I was probably starting to lose it by 6 or 7 weeks.
Okay.
I was starting to lose that.
So he's
Yeah.
starting to lose where it is in space, so what does that tell you?
Proprioception.
Well, it tells you proprioception,
DCML.
DCML, right. Bowel and bladder, in the majority of patients, did you have any bowel and bladder?
Probably bladder was starting around by Thanksgiving.
All right, so starting a little bladder, but initially, not really. And then girdle-like sensation, and that's sort of classic. All right, so here's sort of the things it's associated with. So viral infection, do we have any indication of that? No. Pneumonia? No. What about MS?
We haven't ruled that out yet.
Yeah,
What?
it normally affects vision.
It normally affects vision. Does it always affect vision?
No.
No, but that was a good thing, because you guys did that great systems review, and that was your first question, so boom. And we'll talk.
And they continued to ask every time.
Are you sure you're vision?
Yeah, because they were, now that you brought it up, that they were thinking that. They were thinking that MS, but the key that was missing was the vision. And every time I'd see a doctor or see the doctor, how's your vision? How's your vision? My vision's fine.
You mentioned something earlier that just made me start thinking, and it's working its way from distal to proximal. And doesn't Lou Gehrig's disease do that?
Yeah, and we're gonna, actually, no, we are not. We will talk next semester, in the fall, about it. Lou Gehrig's disease can definitely go distal to proximal. It's not as distinct, of course, as Guillain-Barré is, but it definitely can do that. But what's not, well, do you guys know what Lou Gehrig's, have we talked about it at all? No. It's here's your Latin quiz, amyotrophic lateral sclerosis. So it's gonna affect, without telling, I'll even tell you the answer. It's a motor neuron disease. It affects primarily the ventral horns, and then also upper motor neuron axons. That's the lateral part. So what's not consistent here with Lou Gehrig's? What? Sensation. Lou Gehrig's disease sensation is usually maintained.
Okay.
But that's, and what's consistent about Lou Gehrig's, that it's degenerative.
Mhm.
So his symptoms are progressing. So, that's why the MS thing makes sense in a way, because his symptoms are changing, they're progressing. MS is a degenerative disease. Neuromyelitis optica, it's basically another more severe form of MS. I think I told you my sister has MS and she really doesn't. She actually has Devix, which is just a different form. Autoimmune disorders, vaccinations, do you have any vaccinations recently?
No, not recently.
So, what are you guys thinking?
I was just gonna ask, were you taking any medications for?
No.
Well, that's a really good question.
Because I'm not positive, I may be confusing this with something else, but I think the patient in my clinic with this had an adverse reaction, like there's a 1% reaction to like Advil, not Advil, but some like medicine like that.
I
can't
wasn't
remember.
taking anything, no.
But that would be similar to the vaccinations. And that's actually, you know, a good question regardless, to always find out if they change their medications, regardless of the symptoms to, that should have been a good history question. MS, just so you know, let's look at this a little bit. We've got, it's autoimmune, you guys know that. 15 to 80% had transverse myelitis. So that's a very common history or finding for people with MS. So that would be consistent, and he had this transverse myelitis. What else was consistent with MS for him? What? Upper motor neuron. What else? Degenerative. Earl?
MS more bilateral?
What?
Is it?
It is typically bilateral, but not always. I mean, it is typically bilateral, but it's often asymmetrical, where one side's worse than the other. Do you have any left symptoms at this point?
No.
Okay, so it's all unilateral. So you're right, that would be a little bit hard to do as far as the neuroanatomy. Some other things about MS?
Higher latitude, like he was brought up in Maine.
That's
Yes.
right, very good.
That's a
Yep.
really good one, the latitude.
Yep.
So he's a New Englander, so
Mm.
that's consistent, isn't it?
Yeah.
Race?
Majority of the people that have MS in the world are in that northern latitude, all the way around the world. Yeah,
So
so I was from the right area to have MS.
typical age of onset is between 20 and 40.
So that was, yeah.
Race, Caucasian.
Yeah.
Yeah. But women more than men, but that's, so he has that MS profile. He came from New England, he's Caucasian, his symptoms started at 28.
Yep.
28. So it was degenerative, he had upper motor neuron signs, he had sensory loss, he had transverse myelitis. And what was bothering the doctors? Vision was bugging them, wasn't it? Okay, so then what happened?
So then we can really like jump off, we have to jump ahead because we
We're
never
jumping.
have enough time.
That's all right.
So we can go right to Christmas, and I mean, it's really important to point out here how the doctor was just like not proactive at all. He wasn't aggressive about this, because now it's Christmas, and my entire right leg now is involved, to the point that I'm actually kind of walking with a hip hiker on the right side. I mean, on stairs and stuff, I'm like having to plant my left foot first and then pick up my right foot. Plant my left, pick up I was stationed on a ship, so my work environment was really not conducive to this. And anyway, so by Christmas time, my entire right side is involved, and by Christmas time, I am definitely having a problem with voiding, because I have the sensation of the bladder and needing to go, but when I go stand at the urinal, it doesn't happen. I have to wait for it. I have to actually concentrate on it. Like, okay, let's go, And the other thing that's happening by Christmas is that I'm starting to have sexual dysfunction in reverse. In that it gets up and it just stays up. Okay, I mean, which is great for you guys. People, but I could have been in the movies. But just saying. But it gets up and it stays up. But then but ejaculation, again, is like, kind of like with the urination, is that this, I mean, the sensation is there, but it's like forever. I mean, you know, and it's happening, but it's ridiculously long, a long duration. Not right, it's just not right. And so I've got sexual and bladder. At this point, my bowels are still fine. But, so my entire right side and my bladder and the sexual is all, this is all by Christmas now. We started this the 1st of October. We got October, November, December, 3 months have gone by. And now, and I mean, I'm clearly now, I mean, I'm going downhill fast. And
Let's stay there for just a minute. I know you're going. So what's going on with the bladder? So, well,
Sympathetic.
I'm hearing all kinds of words, parasympathetic and sympathetic.
Well, sympathetic is something wrong, because there's no ejaculation, you can't.
Well, you're jumping, all right, we're at the sexual, we got that one. That one's pretty easy, because that's like a point and shoot, right? Point's working, shoot's not, right? So what does that tell you as far as the neuroanatomy of it?
Sympathetic.
Maybe sympathetic. So where is that in the neuroanatomy of it? Yeah, thoracic or high lumbar is what it's telling you there. And then parasympathetic, at least the tone is there. He's having that response. So is that sacral or? Sacral. Right. And then why can't he voluntarily void?
Can't relax the muscles or contract the sphincters.
And
Or
how do you do? Well, how do you do it?
How do I do it?
From where? How do you control your sphincters neuroanatomically? Do you think about it?
No. Your external
You don't?
sphincters.
You don't go into the bathroom and just reflexively go? Or do you actually say, okay, now I have my pants down, I am sitting, it is time,
Yeah.
right?
Right.
So where do we control it from?
Voluntary.
It's voluntary. From our what?
Brain.
Right.
What part of our brain? The cortex. We have cortical control. Does everybody have cortical control? And we have to gain that, just like we do of many of our reflex. So there are certainly the Micturition reflex that happens with your bladder. Like infants, they don't have this problem, right? They just go, right? They have the reflex, but can they cortically control it? No. So, but what you're telling us is, one, he had the sensation. You could tell your bladder was full. So that means what? What's intact? Well, we still know autonomic afferents are still coming up. So we're still getting autonomic afferents. So he's feeling his bladder full, and then if you really, really tried.
Yeah, I could go.
But it was really hard. So cortical control of it was sort of becoming a problem. So, and then what happened?
And so we went into January, and then by January, it started in my left foot. It's the exact same thing in my left foot. I started with my toes, into my foot, into my ankle, and it started up the other side.
Was it as quick as, was it as slow as the right side, or was the left side real quick?
Well, I guess, I would probably say it was probably, I mean, I'm not gonna say it happened overnight, but, let me just, to answer that, I would say that, first of all, nothing else has been done with the neurologist, nothing. And I'm still like, just going along, I don't know, I can still look back on this and think like all the things I should have done, all the questions I should have asked. And I was just like going along with this. Like, I don't know, like someone was gonna figure this out and everything was gonna be fine, because I was 28 and I was invincible, you know, and so it was like, as I was getting maybe a little freaked out, but it was like, yeah, it's gonna be fine. And then it got into my left side, and this is the 1st of January, and at this point, I don't even remember seeing the neurologist again. So, from the 1st of January till Valentine's Day, it just continued to get worse. Up the left side, and I guess I did see the neurologist in there someplace, but clearly this neurologist did not have his shit together. I mean, how could he not be, anyway, so so it's Valentine's Day. Well, no, it's the 13th of February. And I mean, I'm limping around, and I can't hardly go to the bathroom, and I'm still going to work, and nobody's doing anything, and I'm not doing anything, so I'm partially at fault here. And so 13th of February rolls around, and I got up that morning. I mean, the void thing is starting to get really bad, really bad. And the limp is, needless to say, now that the left side's somewhat pretty much involved, I'm kind of stumbling around. And so on the 13th of February, I got up to go to work, and I was living off ship with my wife, and I couldn't void. I mean, I hadn't been to the bathroom since 7 o'clock the night before. It's like 6:30 in the morning. Obviously, I have a full bladder. I cannot go. I can't go. So, okay, now I'm finally getting like the idea that maybe this isn't a good thing. And called the neurologist, and and the neurologist, by now it's like, you know, we had to wait for the office to open, so we call him at 9 o'clock, and he says, come right in. We go in, he prescribes me a diuretic, you know, and says, you know, go and get this script and go home and take one, and that should relieve your bladder. I went home, I took 2, which, diuretics work, you know, and I went home and took 2, so let's say I got home at 11, I took 2, nothing happened. I still haven't voided. Call the doctor back, it's now like early afternoon, the doctor says, no, this is in a small town in Michigan, they just have a community hospital, and he says, you need to get to the ER, we need to empty your bladder. I mean, it was getting critical, you know. So he said, I'll call the ER, they'll be expecting you. So my wife drove me to the ER, and they were waiting for me. They put me on a gurney, took me into a room, and catheterized me. And I probably passed like a gallon of urine, you know. And that was, so they said, we want to keep you, I stayed overnight for observation. Clearly everything came tumbling down. The shit hit the fan. So they kept me for observation, and I was still able to walk that night. And on Valentine's Day, 1985, the nurse came into the room and said, you know, you came in through the ER, so we didn't weigh you, so we need to weigh you. Can you stand? And I said, well, yeah. I said, but you know, you should probably stand on my right side here because I'm kind of weak. And I don't really remember I don't remember what kind of sensation I had. I don't remember not having sensation. I remember swinging my legs over the bed, and she had the scale right there. And when I went to stand, there was nothing. She caught me and put me back on the bed. And that was the last time I walked. I mean, the night before was the last time I walked. In the course of that, from the time my bladder shut down, so basically from 7 o'clock, in 24 hours, I went from all the stuff we've talked about to it finally just shut down. And I couldn't stand, I couldn't walk, I couldn't move my legs, I couldn't feel my legs. It was all over. Like that, boom, done. So it went October, November, December, January, 4 months. I went from walking with a limp to not walking, and they still didn't know what was wrong with me.
What do you guys, do you have questions, or what are you guys thinking? Nothing. Any questions?
What kind of tests did they do in the ER?
Nothing. They didn't do anything.
Did they know what was going on?
No.
Like your doctor wasn't like, by the way, there's also these symptoms? They're just like.
I don't know that. I don't know that. As far as, yeah, you know, like the people on the floor. I remember my family practitioner checked in with me the evening before. He stopped by, you know, and then and that's it. I mean, this is the thing, you know. It's like, this is where, I mean, when you get out there, it's like you have to take this shit serious. Don't like just, you know. And I know you will, but anyway. So I have.
So what might explain just this, like before now it was sort of this progressive loss of function, and then it progressed to bladder. Did you battle about bowel?
Oh.
At this point.
Well, no. Well, the February 13th, 1985 was the last time I had a voluntary bowel movement. There's a note in history. The last time, and once I became paraplegic on Valentine's Day, my bowels shut down. They did. I mean, I shut down. So, going back, what level was the transverse myelitis at?
5.
So at my nipples. So on February 14th, I had no feeling from here down. Still don't to this day. You could put a cigarette out on me. In fact, just to give you, this is a perfect example. I was at the pool this morning swimming, and that doesn't look like a very big scar right there, but it was scabbed over, and you know, that's big enough so that if you scrape the scab off, you're gonna feel it. So I was drying off after swimming, and I was like, I looked at my hand, and it was full of blood. And I was like, oh shit, I'm bleeding somewhere. Because that's how I am. I can't feel anything. And so I said, oh, I bet I know what it was, because anyway, yeah, sure enough, I had ripped the scab off. There was blood all running down my leg. I couldn't feel it. I have zero sensation from the tips of my toes.
Oh, you just had clonus. Did you guys?
To here. Yeah.
No. Nope.
But I won't do it.
Anyway, it's not voluntary.
So anyway, so it's February the 14th, and there you go. It's February the 14th, and that's where we're at. And they got nothing. So we could really like jump ahead, because what happened then was. Go ahead.
Just the only thing really is just to realize that when he was not voluntarily voiding, that is a medical emergency.
Yeah.
That is not one like, let's go through your session, see how you're feeling next time. No, this is get out of here, go to the ER, and that's medical emergency. You guys got the parasympathetic. Uh, Before we go on to what happened over the next few years, does anybody have any ideas? What are you thinking?
I think it has to be some kind of stenosis because it's just so progressive, and it just probably got to a point where it just closed completely.
Okay, that's not a bad thought.
You're in the ballpark.
You're in the ballpark. So that's something completely. So what about DCML now? Gone. Anterolaterals, sympathetic, gone. Okay, so at this point it's essentially, and it's bilateral, so it's both sides of the spinal cord and everything. Okay, so then what happened over the next few years?
So what happened was, long story short, I mean really long story, but the military medical boarded me, which means essentially they sent me, I was in a private civilian hospital, they sent me to a military hospital, ran all the tests over again because they had to build a case up to determine my medical or lack of medical capability to stay in the service. They determined that I was unfit for universal duty. Consequently, my discharge was recommended post haste. I got discharged from the Coast Guard, retired on a full disability. Well, no, I got turned over to the VA, and I got turned over to the Veterans Administration, which I had to apply for. Back then you had to actually fill out papers, and you couldn't do it online. And I got turned over to the VA. The VA took me in and determined that I was 100% disabled, service-connected, which means if you're a service-connected disabled veteran, that means you get a disability compensation for life because it happened when I was on active duty. So I got, and then I get all my medical through the Veterans Administration. So I got discharged. I went back to New England with my wife at that time. Got divorced. Well, I started going to the VA every 6 months. Got established with the VA in Manchester, New Hampshire. Never had any formal rehab. That fell through the cracks. I mean, that whole thing is just like, we won't even go there. So I had to start fresh. So I'm 28 and.
Did you have any more symptoms?
No. Okay. So what happened after the 14th, when everything shut down, or February 14th? That was it. And so they discharged me with a diagnosis of transverse myelitis / MS. Because MS is particularly more so back then. Before MRIs, MS was a real catch-all. And so I had enough symptoms where they could put transverse myelitis / MS. So I had enough, but every time I'd see a new doctor, it would be like, how's your vision? My vision's fine. So I was like, Anyway, it didn't matter.
How'd you feel about the diagnosis of MS, though?
I didn't like that MS because what I didn't know about MS, what I researched about MS was I was going to get worse. One of these days I was going to wake up and my hands were going to be involved, or my vision was going to be involved. And I was really freaked. I mean, it was a black cloud over my head. So so the years pass, and I get used. I learn how to drive a car with hand controls. I learn how to use a wheelchair. I learn about my bowel. I learn a bowel program. I learn a bladder program. I get divorced. I have no real. I'm getting a paycheck every month. They pay you good money to sit in a wheelchair. They really do. Yeah. The only guy that makes more money than me, disabled veteran-wise, is a blind guy. If you want to go max out, be blind. Because they pay big money. But truthfully, and I've been around a lot of disabled people, and you will be in your careers. And remember that I said this, and see if you don't agree as you meet more people that are disabled. Worst possible disability, I would never want to be blind. I just can't even imagine it. I would sit in this wheelchair, I would be a quadriplegic before I would be blind. Blind is just like, I have known 2 blind people in my life, people younger than me, and just think about, like, yeah, it's just, think about all the things you do with your eyes. Even if you're a quadriplegic, you can at least watch TV, read a book, look out and see what a nice day it is. If you're blind, you can't even do that. Sure, but anyway, I gotta move on. But blind is like, just kill me, really. Anyway, so 86 goes by, 87 goes by, and we get into early 88, and I go to the VA in Manchester, New Hampshire, and I have a new neurologist. I had been seeing a neurologist at the VA, but she was another loser. I mean, like, she just was. You got just like everything else. You got good doctors, bad doctors. And I never got a good neurologist. So I go for my 6-month visit with the neurologist, and they tell me that I'm going to see this Dr. Gann, who, okay, fine. I go into Dr. Gann's office, and you notice how I remember his name. And I can remember all the names of all the key people. And Dr. Gann, in fact, I can see him. And I go into his office. Now, this is paper charts before electronic charting. And he has he has 2, there actually was 2. He had 2 charts on his desk that were me, and it was probably about that thick. And he said, I've been reading this stuff, and you don't have MS. He goes, I don't know what's wrong with you, but I'm going to figure it out. And if you're with me, we're going to figure this out, because you don't have MS. And I read it all, and this isn't right. And then he goes on to say, now this is early 1988, and he says, down at the Boston VA, which was only like an hour and a half from Manchester, New Hampshire, he said, down at the Boston VA, they just got an MRI machine. Okay, this is March of '88. Just got it, brand new. It's just gone online. I mean, basically, they're still learning how to use it. And he says, there's already a 6-month wait, but I want to get you on this MRI thing and, see what happens. He goes, it's painless, won't cost you anything. All you got to do is go down, stay overnight, and we'll do an MRI. We'll see what happens. I said, okay, yeah, fine with me. I got nothing to lose. Now, like 3 years has gone by. It was a 6-month wait. Well, like a week goes by, week and a half, whatever, not very long, 2 weeks tops. Phone rings, it's Dr. Gann. He says, hey, they decided cancellation on the MRI waiting list. And he said, I thought of you, this was like, I'm gonna say a Friday. And he said, can you be down there, check in Monday afternoon, they'll do the MRI on Tuesday? I said, sure. So down to Boston I went, had the MRI.
I'm just going to interrupt you just to tell them that the MRI did get a Nobel Prize.
Yeah.
And he brought the...
And this is the only National Geographic, I used to get National Geographics, and this is the only one that I still keep. And this is the MRI, January 1987, MRI made the cover of National Geographic. And and I was looking at it today. I hadn't had it out for a long time, but I knew right where it was. It did a 38-page article on MRIs and imaging in general, because the MRI was just a breakthrough for all types of medical imaging. you know what I mean. And there's actually a picture here, and this is kind of primitive by today's standards, but there's a picture of a person's spinal cord with, and I'm just showing you that. So I went down and I had the MRI and in the morning, and that afternoon.
I'm gonna show them what you saw.
Yeah.
I'm gonna tell you what.
That afternoon, of course, now this is cutting edge stuff now. So right now, like I was on the neurology floor this is the Boston VA, is a big hospital, and I was on the neurology wing, and they told me at 1 o'clock, be done in office such and such on the whatever. And so I went there, and there was probably like 6 neurologists in there, including Dr. Gann. And of course they were all, this was really cutting edge. They'd only had the thing since January, so they were all interested in anything like this. Because here I was like a test case. And I went in and they had the light boards on the wall with all my images. And it was so clear that I looked at it and I went, it was kind of like that. I looked at it and went, there's the problem right there. Okay? I mean, that's what this picture is. It's the same thing. Okay? And it says, facing page. This side view MRI scan was made. The patient, a 4-year-old girl, lost the use of her legs. The scan showed a tumor, shaded red, in this enhanced version, growing in her spinal cord. Acting quickly, the girl's surgeon removed the tumor, and now in a remarkable recovery, she can walk again without braces. That's what I had. And MRI was like, boom. Like, there it is, boom. And so they said, of course, with me, the damage was done. Now this is, I would have been on an MRI machine like in October of '84. And I've met people, and Andrea's husband, who's a neurosurgeon, does them all the time. They take these out like, it's like changing the oil in a car. It's like, we just got a tumor in the spinal cord today. No big deal. So just pop that out and be home for lunch. Am I right? Really? That's so routine.
Essentially, and we'll talk about, what's consistent or not consistent with a tumor? What are you thinking? Why would it grow and then stop like that if it was just a tumor? Does that make sense?
Benign.
It was benign, yes. And I did have, the last piece of the puzzle was, so they said, so after, I'm in this meeting and they said, we'd like to do exploratory surgery to at least get enough to do a biopsy. And I said, well, okay. And if we can, we'll take the whole thing out. And I said, okay. And they said, and we have to have a cancellation like day after tomorrow. So, if you're up for it, we'll just do it. And I was like, I got nothing to lose. So they took it out. It was totally benign, but of course the damage was done. So I am, this is since, but a huge, the black cloud of MS was lifted, and what they called it at the time was not a tumor, but a hemangioma. And what had happened was,
yeah, I put it up. You can talk about it. You say it in your words.
What had happened was it hemorrhaged, and they will do that. You can have they're not uncommon, and it's not uncommon for them to hemorrhage. There was no trauma, nothing. It just one day, and that accounts for the 4 months. As it hemorrhaged, the more it hemorrhaged, the more of my nervous system shut down. And so and eventually on Valentine's Day was the last hemorrhage, basically, I guess. It was like it shorted out. I always, in layman's terms, compare it to electrical system. Because that's what your nervous system's like. It's an electrical system. So it was like the breaker panel. It was like the breaker panel from all the circuits from here down it was like pouring water on a breaker panel. And as these various nerves got involved with the hemorrhaging, they shut down. And just like shutting the breakers off in your house. And consequently, that's what I ended up with. And that's why.
So it's essentially a tumor of the blood vessels. And a lot people walk around, and you had it. You're born with it.
Oh yeah, when they did the pathology, they did a pathology workup on it, and they told me that they were able to determine that I was born with it. It was there the whole time.
And then it just, so if you read the literature on it though, most people get their symptoms 20s to 30s. It's marked pretty well. And I thought this was interesting. I just got this straight off the internet, that it wasn't reliably diagnosed until the MRI came around. So he's like our, origin of the whole thing. In the 1980s, previously it may have been misdiagnosed as MS or as a seizure disorder, so they certainly did that. An MRI scan with or without contrast shows it essentially now. I mean, if you read it online, he is textbook. Nowadays, and we've talked about this, is they do the MRI, they see this, if you see motor weakness, you go and have it taken out immediately. So having any motor weakness. So nowadays, you might be left with some type of foot drop, but that would be essentially it. So what I want to do though is, I know we are running low on time, but at least give you guys a few minutes for questions. Now, hopefully, if Mark agrees to my nagging, you'll come back in the fall.
Yeah, I see you guys in the fall.
So in the fall, he'll come back after you guys have all had a day in the wheelchair, and we can ask more questions more about the sort
We'll talk
of
about
wheelchair
it.
and functional and details, but now is a chance for you to ask more questions.
Any more questions about today? About anything?
I'm not sure if you know the answer to this, but what could they have done differently to prevent, like, I guess the length of that? Like, could they have done anything differently
Well, I mean, I
to
don't.
catch it sooner, or is that?
They could have done exploratory surgery.
Yeah.
Which
Oh.
was, exploratory surgery was mentioned at one point. But the truth, I mean, I actually debated it. This is when I was still in the hospital. And the fact that they thought maybe I had MS, well, I had a possibility that maybe, because MS is like up and down. And so I had a possibility, well, maybe if it was MS, I could learn to live with it, and I might come out of this. I might, so if they did exploratory surgery, they couldn't guarantee me they wouldn't make things worse. Because, neurosurgery, again, just 28 years ago was so different than now. They just didn't have the tools that they have, so it's like, so I didn't do it. Again, I have to, the neurologist, that whole thing is just very weird. To me, I don't know what else he could have done, but he could at least have been interested. Anyway, what else? Anything?
I know you said you got divorced. Who was kind of driving you around or taking care of you during all of this?
Well, I got divorced. I guess we stayed together until for the rest of '85, all of '86. We separated in late '86. Got divorced in mid '80s, I moved. By late '86, I had a lot to learn still, but I was able to go. I found an apartment and lived on my own. And I've since remarried. I've been married 23 years, so initially, to answer your question, my wife drove me around, and then finally, a big thing here is, you have to try to appreciate in your future that the scope of, it wasn't just a physical thing that happened. I lost my job. Sure, they gave me a great pension, disability compensation, but I couldn't do my job anymore. I was out of the military, and so I went off on my own, I did, after I started with a part-time job, and then eventually got a full-time job. I learned through the VA, I learned to drive with hand controls, got my own vehicle, and just, it's really, I always say, this is my second life. This is my second life. When you have a disability of this magnitude, you're starting over. I mean, I was essentially an infant again. I couldn't control my bladder. I couldn't control my bowels. I couldn't dress myself. All that had to be learned. I couldn't drive. I couldn't go